Hypertension is a silent killer. This disease has killed a whole lot of people. There are people dying every day as a result of hypertension. And global statistics show that 1 in 3 adults have hypertension. Also, about 1.56 billion people living on Earth have hypertension. That is huge. You see, hypertension is defined as an elevation in the blood pressure of any individual. Hypertension is a disease condition. So you might have high blood pressure, but you might have not gotten to the stage of hypertension. In hypertension now, it becomes a disease where the blood pressure is persistently and consistently elevated beyond normal. Primarily, there is no identified cause of high blood pressure. However, there are some risk factors that can predispose an individual to hypertension. First risk factor is age. People from age 45, 50, 60 and above are vulnerable to developing hypertension. And that is why when you get to that age, there is need to be very, very cautious about your health, cautious about everything you are doing. Also, another risk factor is pregnancy. If you've been pregnant before, you discover that before you know, your body begins to swell, your legs begin to swell, your hands, your cheeks, and so many parts of your body begin to swell. This as a result of increased fluid volume in the body of a pregnant woman, and this could lead to hypertension. It's usually called pregnancy-induced hypertension. Another risk factor is obesity. If someone is very, very fat than normal or is obese, there is a potential that this person might develop high blood pressure. One other important risk factor for developing high blood pressure is family history. If your father has hypertension or your mother has hypertension, there is every possibility that you also will develop high BP. And that is why it's good you know your family health history so that it will guide you in your day-to-day activities. Another risk factor is your dieting. Sometimes we want to enjoy ourselves. We eat different food, fried chicken, fried yam, fried this, and every time you are eating fried, too much of those fried things are not good. They predispose one to high blood pressure. Also, too much salt, low vegetables in your diet, lack of fruits. Going for so many days without fruits could lead and predispose you to high blood pressure. Now, having known that, what are the signs you see in your body that will make you know that you are developing high blood pressure? The number one sign is consistent headache. You begin to have this headache at the back of your head, and you are feeling it even sometimes at the front as well. You begin to feel so heavy, you begin to feel the pains, and you are wondering what's the cause of all this. Well, please check your blood pressure because you might be having high blood pressure. Another sign is weakness, constant weakness. Another important sign is back pain. Low breathing is another sign of hypertension. Now, how do you know you have high blood pressure? The most accurate way to know your high blood pressure is simply to just go get tested for your blood pressure, where a machine will be used. The machine is called sphygmomanometer, or you can just say BP apparatus or BP machine. It's going to be used. A cuff will be tied around your arm, and some buttons will be pressed, and from there 2 numbers will come out. The upper number is called the systolic blood pressure. The down number is called the diastolic blood pressure. These 2 numbers will tell you your hypertension results. If it is greater than 140/90, just know that you are hypertensive. Or if it is greater than that, there is need to go and get checked and start taking drugs immediately. One of the most common diseases that arise as a result of not checking your blood pressure is called stroke. Yes, if your blood pressure goes so high, you could develop stroke. Not only stroke, another big disease is called myocardial infarction, that is heart attack. You've heard of people that will just slump as a result of persistent high BP, unchecked high BP. Also, another one is called heart failure. Yes, after the heart has pumped blood for so longer time, pumped blood higher than what it's supposed to pump, what would happen? Sometimes it may just fail. We have right-sided heart failure, we have left-sided heart failure, depending on the type of heart failure that occurs. That is why it's not good to delay in checking your BP. How do you prevent high blood pressure? First of all, watch your diet. You see, there's a saying that says you are what you eat, and that is true. If you are the type that eats anyhow, you eat anything, you don't have any restriction to your dieting, then you are putting yourself at a big risk. Please watch your diet, watch your salt intake, increase your vegetables intake, take more of fruits, take more of healthy products, natural foods. Some of these things we buy at eateries, restaurants, some of these things are not healthy for us. They are not, many of them. And that is why there is need for you to curtail what you eat outside your home. Homemade food remains the best. Homemade natural food remains the best. Also, check your weight. Make sure you keep track of your weight. Don't be overweight. And to do this, engage in physical activity often. Don't sit for a long while in one place, just staying in one position for a long time, or lying down on the bed watching TV. You sit down and you don't even care about going out, you don't care about working out or going to the gym or climbing the stairs. Get involved in activities that will give you a little push that will make you sweat. Most importantly, there is need for you to drink water regularly. Yes, because water helps you to avoid dehydration, and with that you keep your blood pressure at a normal level. Also, cut down on stress. Some people work from Monday, Tuesday, Wednesday, Thursday, Friday, Saturday, Sunday. They are going out working every day, trying to make ends meet. Now that is wrong. Try to cut down on stressful activities. Plan your time. Intentionally create breaks for yourself. You are not living this life two times. You don't have a spare life. And that is why there is need for you to take care of this one life that you have. Pamper yourself. One bonus tip I have for you is that check your blood pressure regularly. If you are elderly, there's need to check it as constant as possible. If you are on medication, check your blood pressure regularly, because you want to find out and ascertain if the medications given to you are working or not. If you are not on medication, you are a young adult, and you don't have most of these causes we are talking about, still check once in a while, at least once in 3 months, once in 6 months, you check your blood pressure. So that is the end of this video today. I believe you've learned something. If you've learned something new, I would like you to please click the like button and subscribe for more healthy videos. Thank you. Till I come your way next time. Bye.